How do you know when a person with dementia is ready for hospice? Hi, it's Katie Duncan here with Death Care Coach, where we help you better navigate the end of life process. Now, most people know that there are different stages of dementia, but most people don't know when a person with dementia is really in that final stage and when they are dying, and really when they should be recommended for hospice care for that additional end of life support. So, in this video, we will talk about the 13 signs to look for to know that a person with dementia is dying and is really ready for hospice care. They are in that final stage of dementia. Make sure to stick around to the end of this video because at the very end, I will share with you an approximate timeline to death for a person with dementia. Before we get into those 13 signs, it's really important to know what dementia really is. So, what is dementia? Well, dementia is really just an umbrella term that is used to describe many different types of diseases that affect the brain and the symptoms that go along with all of those brain diseases. So, some of those brain diseases that are really considered under the umbrella of dementia include things like vascular dementia, Alzheimer's disease, frontotemporal dementia, Lewy body dementia, Parkinson's disease, Huntington's disease, progressive supranuclear palsy, corticobasal syndrome, and many others as well. Okay, so now that we know what dementia is and all the different sort of brain diseases that are associated, or most of the brain diseases that are associated, let's look at those 13 signs that you can really look out for to know when your person with dementia is dying and really when they're ready for hospice care. By the way, if you are finding this video helpful so far, please, I would really be so grateful if you could click the like and subscribe buttons below on your screen. Again, I would be so grateful because when you like and subscribe to my channel, it really helps my channel grow and really be seen by others like you who might need it and really find these videos helpful. So thank you, thank you, thank you. Let's get into those 13 signs. So sign number 1, the person with dementia will not be able to recall past memories. So really their memory just becomes almost non-existent or not existent at all. Number 2, the person with dementia will really not be able to recognize loved ones and those that they've known for a long period of time. Number 3, the person with dementia loses the ability to speak in a sensical way. Basically, they don't really make sense when they are talking or communicating. The person with dementia may also lose the ability to speak altogether. So they either speak, but really kind of in a nonsensical way, or they can't speak at all. Number 4, the person with dementia usually doesn't really understand what you are saying to them. Sometimes the person with dementia might be able to follow some cues or some sort of direction, but usually they just can't really understand what you're saying to them. Number 5, the person with dementia, you will notice that they might start having some trouble swallowing. So their swallowing might even be such a problem that their diet might include things like softer foods or foods that really don't require a lot of chewing. You might notice that maybe, for example, your person with dementia, they start coughing when they're eating or drinking, or maybe they cough after they've been eating or drinking, and they may even get sick with what we call aspiration pneumonia, which is basically food or fluid contents that they're swallowing that swallow the wrong way and end up in the lung and cause this pneumonia. Number 6, you will notice that the person with dementia is losing weight, even if they continue to have a pretty good appetite. So even if they're eating 3 meals a day or multiple snacks, they're eating pretty well, you're gonna notice that they're still losing weight. Number 7, you will notice that the person with dementia really can't use the toilet without any help anymore. So it is likely that they also become incontinent. This means that they are wetting themselves, or maybe they even have a bowel movement in their undergarments. They really need assistance with toileting now. Number 8, you will notice the person with dementia really needs help getting dressed. They may not be able to get dressed at all. Maybe they just need a lot of assistance, but they need help getting dressed. They can't do it by themselves anymore. By the way, if this video has been helpful so far, I would be so appreciative if you could just hit that like and subscribe button below. This helps my channel grow and it helps it be found by other people who are going through this situation. Number 9, The person with dementia may need some guidance or some assistance when they are transferring from the bed to a chair or when they're walking around. They're going to need some help now. They may not actually even be able to sit up without your help either. You might notice that the person with dementia is having a lot of falls. Maybe they are falling a lot recently, or maybe they can't walk at all anymore. They may need to use a wheelchair at all times, and they may even need to stay in bed all the time. That leads us to number 10. You will notice that the person with dementia is noticeably weaker. Number 11. The person with dementia is sleeping more and more. So maybe, for example, you notice that they are taking naps during the day, longer and longer naps, or more frequent naps during the day. Or maybe they're sleeping longer at night, but your person with dementia is sleeping more. Number 12, if the person with dementia is sundowning, which is this increase in confusion and restlessness, typically in the afternoon or evening time, this might be getting worse. So sundowning is getting worse. And finally, number 13, the person with dementia is almost always disoriented. They may have very brief moments of clarity or brief moments of lucidity where you think they're with you, but mostly the person with dementia is confused. If you are noticing most or all of these signs, then talk to the healthcare professional about getting a hospice consultation. These 13 signs are really indicating that the person with dementia is in the late or really terminal stages of dementia. So that's really why they are appropriate for hospice care at this time. Okay, so I did also tell you earlier that we would talk about a timeline to death for a person with dementia. So let's get into that now. Now, every disease, every brain disease that falls under that dementia umbrella, they all have a different life expectancy range from the moment of diagnosis. So let me give you some examples. So one example is that the average life expectancy for a person with Alzheimer's disease is usually about 8 to 10 years from diagnosis. For a person with Parkinson's disease, the average life expectancy is more like 10 to 20 years from diagnosis. And another example is a person with Lewy body dementia. The average life expectancy is about 5 to 8 years from the time of diagnosis. Now, saying all of that, if your person with dementia is experiencing all or most of the 13 signs that we just talked about here in this video, then it is more likely that their life expectancy is somewhere around 6 months or less. And that is, again, really another reason why hospice is appropriate and recommended at this time. They are showing signs that they are in the final stages of dementia. Now, saying that, everyone is also different. Some people with dementia will live longer, and some people with dementia will die sooner. There are a lot of other factors that come into play here, but generally speaking, 6 months or less is a reasonable guesstimate if you're seeing most or all of these 13 signs that we talked about. If you found this video helpful, please hit that like and subscribe button below. Again, this is more valuable than you can ever know. It really helps people just like you, and it helps people who are going through this journey find this information. So thank you so much, and be sure to check out my other videos on end-of-life care and the dying process on our channel, Death Care Coach. See you soon.